It may be tough learning how to do something different, but then it makes it easier.
Liam was diagnosed with TAR syndrome, which is thrombocytopenia-absentradiu, at about 2 days old. It's a very rare syndrome, and not a lot of doctors have had encounters with the type of syndrome that he has. He was born with his hands at a 90-degree angle. It has affected both of his arms because he is missing his radius bones. Thrombocytopenia is a bleeding disorder, so that affects how he clots or does not clot his blood. And he has also been affected in his lower extremities because he is missing both of the kneecaps in his legs, and has been further diagnosed with having other issues with his femur being twisted and his PCL moving to the side of his leg, which makes it very difficult for him to walk. I asked the doctors if he would be able to write, if he'd be able to hold my hand, if he would be able to do the things that were just daily tasks.
Our relationship with the care team has been fantastic because they have worked hand in hand with all of his physical therapists, occupational therapists, his primary physician. They have all worked together as a team to provide him the best care that we could find anywhere. We traveled around for quite a few places. We went to Chicago, St. Louis, Mayo Clinic, and it was a blessing. I was right here in the backyard.
Both my husband and I like to research things. We like to get all of our questions answered. We like to know what we're facing. And having doctors that are willing to listen to our questions, take the time to answer our questions. We've had some appointments that are 2 to 4 hours long. I feel like we've got other advocates on our side with the University of Iowa doctors. And so we pursued the surgery at University of Iowa, which was pretty extensive. We started off with the right arm, and Dr. Lawler had inserted a pin that needed to stay within his arm to keep it straight for about 6 to 8 weeks. There were issues and concerns about him being able to clot the blood during surgery, and of course that complicated a lot of things. He had also had a history of having staph infections, which complicated his surgeries as well. And so we needed to know that we had a team in place that could manage all of that throughout his surgeries. We knew going into the surgery that we would probably be facing surgery again in the future, that there would be a reoccurrence. After the surgeries, it was very successful. His arms were extremely straight. And we have seen a reoccurrence, but the important thing is that surgery really helped him with his functionality. So after he had that pin inserted, he was in a cast for several weeks following that. And then once that cast was removed, he then had to wear a splint. That process all in itself for one arm took about 3 to 4 months. And then after they felt his body was ready for a second surgery, they went ahead and did the left arm. So the whole process took about a year.
The reason that the U of I Children's Hospital is different from all the other hospitals out there is they focus on Liam as being not a subject or a patient, but as a little boy that they want to help, and their total focus is all on Liam. The first person the doctor talks to when she enters the room is Liam. They don't want to talk to us. They talk to Liam, they ask him how he's doing, how he's playing sports, how is he feeling, and it's almost like he has kind of a friendship with them.
I'm just always amazed at what he's able to accomplish. It's made him more determined. He will try and try until he does what he wants to do. Pitching was a perfect example. It was a little bit difficult for him at first. It was difficult for his coaches to understand his mechanics, but he just kept on doing it and practicing until he figured it out.
The future for Liam is anything that he chooses to do, but I will tell you that what he chooses to do, or what he wants to do, is be a student at the University of Iowa and then
when I grow up, I want to be a sports announcer. I want to go to college at Iowa because I'm a die-hard Hawkeye fan.